my name is Christian. I'll be performing the neurovascular assessment video today. I want to, first thing I want to do is do hand hygiene, okay, and then establish two patient identifiers, name and date of birth. What is your name and date of birth?
Jane Doe, January 1st, 1997.
Okay, great. Now that we've established two patient identifiers, we're going to provide privacy and then begin educating the procedure towards the patient. So I'm going to be doing the neurovascular assessment. This is to assess your nervous system and make sure that it's intact and functioning properly, okay? Now that we can begin the assessment, I do want to disclose something for the video, is that my patient had right knee surgery about a month ago, and so some tests might be very limited, but just in case you cannot perform the test, then I'll perform the demonstration. But I just wanted to, kind of throw that out there just for the video for demonstration purpose only. Okay, so now let's begin. First, we're going to start off with the sensory response to superficial touch and pain. This will be used with a cotton swab, a tongue blade, the reflex hammer, and then something to touch, so like my finger. We want to establish a sharp, dull, and touch sensation. Can you close your eyes? Okay. So I'm going to touch your right arm and tell me what you feel.
Touch.
Okay.
Dull.
Okay.
Sharp.
Okay. Alrighty. And then normally we would test this on every single part of the body, but just for demonstration purposes only, I'm only going to do on one side. So next test is going to be the perception of precision. Can you put your hands on your knees? Okay, fingers out. Close your eyes. I'm going to move your finger and tell me in which direction it goes.
Up.
Okay.
Down.
Okay.
Up.
Okay.
Up.
Okay, so we're going to do this with the hands and the toes. Everything was good. Open your eyes. All right. Okay, so then now we want to identify a familiar object. So close your eyes. Bring out your hand with the palm open. Okay, I'm going to place an object in your hand and you're going to describe what that is.
Coin.
Yes. Okay, open your eyes now. So now that we've established, we've identified a familiar object, we're going to begin doing the 2-point discrimination test. We're going to use a paper clip for this assessment. So I'm going to touch 2 points on your arm and tell me until you feel 1 point.
2.
Okay.
2.
Okay.
1.
Alrighty. Okay, so now that we established that, we're going to want to document our 2 points closest together. The next thing is bring your hand out with the palm open, palm facing the camera. Close your eyes. Okay, I'm going to write a number in your palm and you're going to tell me what this number is.
4.
Yes, alrighty. Now open your eyes. Okay, so also I'm going to begin, I'm going to touch 2 parts on your body and then you just point back to the part that I touched, okay? And then make sure your eyes are closed. Alrighty. Okay. Okay, now you can open your eyes. Okay, so now that we've done the 2-point discrimination test, we want to assess for deep tendon reflexes. We'll be doing this on the bicep and the patella. We're going to be using the reflex hammer. For the bicep, it's going to be used on the pointing tip. And then I'm going to do it on the right arm. So relax your arm, palm open. Okay, I'm going to put my thumb on the bicep tendon. And then, okay, tap. Okay. Alrighty, that's a good response. So then relax your arm, put it down. And then I'm going to assess the patella, which is right under the kneecap. I'm going to use the flat end of the reflex hammer. Okay. All right, normal responses for the deep tendon reflexes. And again, we normally would assess both sides, but just for demonstration purposes only, I'm only going to assess one side. Okay, so then now moving on, we're going to assess the plantar reflex. We're going to assess this on the bottom of the foot, and then with the sharp end of the reflex hammer, I'm going to slide up. Okay, we're going to start at the heel. Okay, a normal response would be the foot moving forward, and then abnormal response would be the foot moving backwards. So, all right, normal response. Okay, so now that we've done the plantar reflex, then I'm gonna assess for clonus. So then I'm going to dorsiflex the patient's foot, and then it should fall down smoothly. If it falls down jerky, then that means that that's an abnormal response. And so smooth is good response. So dorsiflex the foot all the way up and then let it fall. Okay. Okay. The foot fell down normally, so then that's a normal response. There was no resistance or jerkiness or anything like that. Okay, so now for the cerebellar function with proprioception. So this test we might have some problems just because it requires the heel to slide on the shin. So we're gonna try with the left heel, with the left foot heel slide on the right side of the shin. Okay, try with the right foot, the heel. Okay. Normally the heel will go all the way up here, but like I said, my patient had knee surgery a month ago on her right knee, so she's not able to go all the way up with her right heel. But it would be like this, all the way up. Alrighty, so now we're gonna assess for coordination and fine motor skills. This one, the patient will have the eyes closed, and then we are going to with both ends of the arms, of the fingertips, touch your nose. Actually, let me demonstrate for you. Open your eyes, like this. Close your eyes. Okay, good. Now you can open your eyes. Okay, so next thing we want to do is, can you stand up? We want to run in place, but obviously my patient will try her best to run in place, but like I said, she had knee surgery a month ago, so you know, I'll really demonstrate how to run in place. So try your best you can to run in place. Okay, that's good. Normally a running place would be like this. Something like that, but like I said, she had knee surgery a month ago, so that's all we're gonna do for that. So now we're gonna perform the Romberg's test. So close your eyes. I am gonna want to have my hands in the back and the front of the patient to provide safety. And then for 60 seconds, we're going to assess the patient's balance. So try your best for 60 seconds, close your eyes, and just stand there. Okay, that's good. So that was about 15 seconds, but you know, normally we would get a timer and set for 60 seconds to assess the patient's balance, but for demonstration purposes only, I'm only gonna do 15 seconds because, you know, we understand what we're supposed to do. So now lastly, we want to, you can open your eyes now, to assess for gait. So the patient's going to walk, and then I am going to see how they walk, assess their rhythm, their posture, and their arm swinging. So she'll try her best to walk, but she might have a limp on her right side. And then once she's done, I will do the proper walking just to see what it's supposed to look like. So can you walk forward and walk? And come back to me. Okay. Alright, posture is straight, good rhythm and stuff, but normally a walking would be like this. Okay, now you can sit down. Alright, so that pretty much sums up for the neurovascular assessment test. Now, before exiting the room, we want to, say that they did a good job, the procedure is going to end, and then hand hygiene, and then exit the video. So, alrighty, thank you so much. Alright.